Ira Byock MD, Dying Well, Peace and Possibilities at the End of Life. Discover the transformative possibilities of approaching the end of one's life with wisdom, understanding, and love. In Dying Well, Peace and Possibilities at the End of Life, author Ira Byock, MD, discusses the many challenges faced by patients, families, and healthcare professionals in the context of end-of-life care. The book delves into the inadequacies of the American healthcare system, the prevailing attitudes toward death, and the lack of education surrounding this crucial aspect of life. By navigating through personal experiences and revealing the potential for growth, healing, and serenity even in the face of physical deterioration, this summary offers valuable insights that can help facilitate a more compassionate and fulfilling end-of-life journey.
The American struggle with end-of-life care. Americans typically shy away from thoughts of death, instead, focusing on life and how to improve it. This lack of constructive thinking leads to deficiencies in the U.S. healthcare system, resulting in inadequate financing policies, a disregard for hospice options, and inadequate training for medical professionals in end-of-life care. As a result, dying can be a distressing and undignified experience for both the ill person and their loved ones. However, amidst the crisis of an imminent and untimely death, there are opportunities for nurturing, honoring, and celebrating the departing person. Thus, it is possible to die well, even in the face of death's inevitability. The art of dying. To many, dying is a daunting and painful event. However, with proper care, it can be a profound and even joyful experience. Doctors can ease the pain and lessen the anguish of dying patients. Loved ones must make sure that the person dying receives the best care possible. The end of life should be aligned with the wishes and goals of the patient and the family. If handled well, dying can offer precious opportunities to complete life's most important relationships and provide a sense of well-being for the patient. End-of-life conversations. This book snippet provides brief but insightful responses to common questions on how to deal with end-of-life situations. Through the scenarios and advice presented, readers are advised to talk about death, give comfort to their loved ones, choose suitable nursing homes, and seek medical attention when necessary. As we approach the end of our lives, dealing with tough questions and situations can be challenging. This book summary offers a glimpse of valuable advice on how to navigate challenging end-of-life situations through a series of questions and answers. The first scenario explores how to talk about dying with a loved one who has advanced breast cancer. The advice given is to embrace the natural order of life and not shy away from an open discussion about death. The next situation deals with a person in a coma, where loved ones are advised to assume that the individual can hear them and give them simple but heartfelt gifts to make them comfortable. In the case of an unwell stepfather living far away, the advice is to stay in contact, offering any assistance possible, and which nursing homes would provide the best care to a loved one. The doctor-patient relationship also plays a vital role in dealing with end-of-life situations. Inquiring about the patient's pain is crucial to understand how to treat them effectively. The book snippet also touches on a situation where a person with advanced AIDS asks for help to plan their suicide. The response emphasizes the importance of encouraging openness in discussions and that every individual has the right to end their life as they see fit. Lastly, the book summary provides advice for parents of children with leukemia on how to manage their child's pain while receiving adequate medical care. The bottom line is that aggressive treatment is essential in treating childhood leukemia. In conclusion, the book snippet's key message is to talk about death, find ways to comfort loved ones, choose nursing homes carefully, seek medical attention when necessary, and to be open in end-of-life conversations. Having these conversations can help individuals make informed decisions, ease suffering, and make the end-of-life process more comfortable. Dying well. Conventional medicine's attitude towards death is focused on curative or life-prolonging options, regardless of the cost and difficulty of the treatment. However, it's not the only option, and palliative care and hospice programs are attractive alternatives that prioritize dying well. Many people are unaware of these alternative options, depriving them of the chance to die with dignity and comfort. It's crucial to discuss and consider the benefits of palliative care and hospice programs as an alternative to traditional medicine's sole focus on extending life. Physician-assisted suicide, a debate on dying. Advocates of physician-assisted suicide argue for the right to hasten death and alleviate suffering for the terminally ill. However, there are grave equity concerns for marginalized groups who can't fully participate in the decision-making process. While there are shades of gray, the ultimate responsibility for end-of-life care remains with the dying person and their family. The idea of dying well is foreign to many, but there are viable options beyond assisted suicide, such as alleviating physical pain and providing emotional support. It is essential to provide the best care possible to improve the well-being of any dying person. Redefining Death, an Insight to End-of-Life Care. In his book, the author discusses how we can change our perception towards our loved one's death by ensuring the provision of personalized and comprehensive end-of-life care. The book emphasizes on the need of having specialized clinicians and palliative care experts trained in treating the dying to make death a dignified and comfortable process for the patients. Moreover, the author also addresses the essentiality of treating dying as a natural phase of life and viewing it as an opportunity to provide loving companionship and emotional support to our loved ones. The provision of end-of-life care should be considered a fundamental human right, and it involves basic elements such as accommodation and assistance with daily life activities. By doing so, we can help dying individuals accomplish meaningful tasks and reconcile with friends and family members. The book conveys a positive perspective on end-of-life care and serves as a guide to learn how to make a dying person's journey memorable and bearable. Acknowledging the value of life. In the final moments of a person's life, the caregiver plays a crucial role in recognizing their core identity and fundamental dignity. Celebrating the dying person's life has significant emotional value for both the individual and their loved ones. A compassionate and enlightened end-of-life treatment elevates death to something worthy and even sacred. Being present and attentive during this time allows the caregiver to bear witness to the value and unique qualities of the dying person's life. By acknowledging their identity and dignity, the caregiver provides support and comfort to the individual and their family. This loving end-of-life treatment not only honors the person's life but also leaves a lasting memory for everyone involved. In the words of some loved ones who have witnessed compassionate end-of-life care, it is truly sacred. Taking time to celebrate the person's life can be hugely significant, as it provides closure and demonstrates the meaningful impact they had on those around them. In conclusion, the caregiver's role in the final days of a person's life can have a profound impact on their loved ones and their legacy. Acknowledging the value of their life and celebrating their unique qualities through compassionate end-of-life care offers a chance for closure and leaves a lasting memory of their impact on the world.
Ultimately, the message of A Dying Well is that death can be approached in a manner that leads to growth, understanding, and fulfillment for both the dying individual and their loved ones. By recognizing the importance of palliative care, addressing misconceptions about pain management, and advocating for a more holistic approach to end-of-life care, the book provides a valuable resource for anyone facing this inevitable yet misunderstood part of life. Evolving our cultural mindset and addressing the gaps in our healthcare system are crucial steps toward achieving the goal of a dignified, peaceful, and meaningful dying experience. With open communication, empathy, and a commitment to providing the best care possible, we can redefine the way we engage with the end of life, and, in doing so, reaffirm the value and beauty of a life well lived.